I know sometimes we have occasional pains and aches in our shoulder joint, and we don't really pay much attention to them. And that's okay as long as they go away, but sometimes it can progress into a very painful and debilitating condition called adhesive capsulitis or frozen shoulder. Frozen shoulder is where the capsule that surrounds the joint shrinks down, kind of like shrink wrap, and that prevents the joint and the bones from moving freely and can become very painful. Frozen shoulder symptoms usually progress exponentially over time. So if you're starting to feel any symptoms like decreased range of motion and extreme pain, get help immediately. Some of the things that cause frozen shoulder, or maybe you've had some trauma or a surgery to a shoulder, maybe you have a medical condition like diabetes, or you've had a stroke. Some inflammatory conditions like arthritis or fibromyalgia can cause frozen shoulder. Also, if you're between the age of 40 and 70, and more particular, if you're a woman and postmenopausal, those are some risk factors to developing frozen shoulder. Everyone seems to go through this process with frozen shoulder, maybe a little bit different, but there are some things that we found that are consistent. There's 3 phases, and these phases can last anywhere from just a couple weeks to several months long. The first phase is the freezing phase, where you're starting to develop more pain, and you're noticing that your motion is becoming more limited. Even when you try some stretching exercises, it's very painful. The next phase is the frozen phase. So your range of motion isn't getting worse, but it's not getting any better, and it's really painful to move. The last phase is the thawing phase, where range of motion starts to get better, pain starts to diminish, but it's still pretty sore when you move it, but you're noticing you're getting more motion. This is the phase that we can really help with. It's this last phase, or the thawing phase, that really only happens with proper treatment. So if you're starting to develop frozen shoulder, we can help move you through the first 2 phases a lot faster, and then begin that thawing phase and really make a difference. While injections and surgery are options to treat frozen shoulder, they don't often provide you with true relief. Studies actually show that people with frozen shoulder who attend physical therapy regularly will notice a difference with decreased pain and increased range of motion within 4 weeks. I want to show you 3 exercises that you can start doing to help relieve pain and get some of those muscles to relax so you can increase that motion. Okay, the first exercise we call pendulum exercises. What you're going to do is stand next to a firm surface, a counter, a steady chair, something like that you can bend forward and let that affected arm, or the shoulder, the arm with the shoulder that hurts, kind of hang down like a piece of rope. Now the goal is to not have a lot of muscle tension and contraction on that side that you're moving. You want it just kind of swinging and moving freely like a piece of rope, just to get some gentle motion going. Great. So the next exercise is overhead wand exercises. You can use any sort of dowel or stick or a broom handle that you have at home. When you're doing this exercise, the affected side, we want it to be as relaxed as possible. Not using the muscles on that side to get the motion, but using your other arm to get the motion. The closer you hold together, the more control you'll have with that arm that's not affected to help get you up overhead. The further apart you go, it might be harder to relax that side, but as you progress, you can definitely go further apart. The last exercise that I'm going to show you is internal and external rotation using the wand. So that same stick that you used for the last exercise to go up overhead, now we're going to get some internal and external rotation movement of the shoulder. I'll be honest, these ones are probably going to be the most painful and the most limited. It's very common with frozen shoulder to be limited in these motions more than overhead, but they're extremely important motions to help get you to be able to move fully overhead because of the way the ball or the head of the shoulder bone has to move when you're going up overhead.
Take me back to California. I wanna go back to 2018. I wanna go back to when I was happy. So take me back to California, please.
Okay, hopefully you did okay with those exercises. With the wand exercises, you want to go nice and gentle and just get more motion every time you go if you can. Hold for 10, 15, 20 seconds. On the pendulum, you can do forward and back, side to side, clockwise or counterclockwise circles, increasing the motion every time you go, but just keep it nice and gentle. Hopefully you did okay with those. Give me a shout out if you have any questions or problems.